In today's video, we're going to review the cerebral lysine and recovery after stroke trial, or CARS as it's also known. This was a randomized, placebo-controlled, double-blind, multi-center trial. The study was published in January 2016 in the top journal Stroke. Cerebral lysine is a sophisticated drug of biological origin and consists of low molecular weight neuropeptides and free amino acids. Cerebral lysine has been shown to exert neurorecovery properties in various experimental and hypotheses-generating clinical trials. So, in an effort to confirm these findings in a clinical setting, the authors set out to study the effects of cerebral lysine on patients with moderate to severe stroke. They recruited 205 patients with ischemic supratentorial strokes of at least 4 cubic centimeters, which were confirmed by computed tomography or MRI. 104 of these patients were randomized to receive cerebral lysine and 101 were randomized to receive placebo. Both groups were comparable with respect to various factors like age, gender, BMI, comorbidities, and thrombolytic treatment. Patients in the treatment group received 30 milliliters of cerebral lysine diluted with saline to a total volume of 100 milliliters per day starting 24 to 72 hours after stroke, which continued for a total of 21 days. Patients in the placebo group simply received 100 milliliters of saline during that same time period. Each patient in the treatment and placebo groups participated in an accompanying standardized rehabilitation program for 21 days, also starting 48 to 72 hours after the stroke. All patients continued with 30 minutes of active movement for 3 days per week after discharge. The primary study endpoint was 90 days post-stroke. The authors assessed various functional parameters at baseline and at day 90 and compared them to see if cerebral lysine had any beneficial effects. So here's what they measured. The primary outcome was upper limb motor function as measured in change in the Action Research Arm Test score. They compared the median scores of the Action Research Arm Test at baseline as well as on days 7, 14, 21, 42, and 90 after stroke in patients on cerebral lysine versus placebo. Here's what they found. The median score in patients on placebo was 2 at baseline and increased to 27 on day 90. Conversely, the cerebral lysine group started out with a median score of 0, which increased to 51 on day 90. For better comparison of the overall effect of cerebral lysine, the authors also calculated the so-called Wilcoxon-Mann-Whitney test, or MW in short. The Mann-Whitney test represents the probability that a randomly chosen subject from the cerebral lysine group fares better than a randomly chosen subject from the placebo group. A value of 0.5 for the Mann-Whitney test implies equality between cerebral lysine and placebo. If it's above 0.5, this means that cerebral lysine is superior. A value below 0.5 means that cerebral lysine is inferior. Here are a couple of benchmark values. They calculated the Mann-Whitney statistic for days 7, 14, 21, 42, and 90. Here are the results. On day 7, the Mann-Whitney statistic was 0.53. The confidence intervals overlap 0.5, which means that this result is not significant. However, day 14 is where things start to get significant with a value of 0.62, day 21 0.64, day 42 0.68, and day 90 0.71. So overall, cerebral lysine was associated with a large superiority compared to placebo when it comes to the Action Research Arm Test. But that's not the whole story. The study also looked at a couple of secondary outcomes apart from upper limb motor function like gait velocity, fine motor function, global neurological state, the level of disability in daily life, the extent of aphasia, the extent of neglect, quality of life, and finally, the extent of depression. So here's the value of 0.71 for the Action Research Arm Test that we've seen before. Cerebral lysine also proved to be superior when it came to global neurological state, disability in daily life, quality of life, and depression. The values for the other measures were suggestive of potential benefit, albeit statistically insignificant. When they combined all of these estimates into one point estimate using the Wei-Letchen method, the combined effect of cerebral lysine was associated with an overall Mann-Whitney statistic of 0.61, and this was statistically significant. So to wrap up, the authors concluded this study provides evidence that cerebral lysine has beneficial effects on functional and global outcome in early rehabilitation patients after stroke. And what makes this trial stick out from the previous ones is that this time only moderately severe to severe strokes were included, and this was the first trial that administered rehabilitation concurrently with cerebrolysine and placebo. Throughout the trial, cerebrolysine safety profile was comparable to that of placebo, suggesting that the drug possesses a favorable risk-benefit ratio. So we hope you enjoyed this video. Absolutely make sure to stay tuned for more interesting teaching content to come.